Hello friends, I am Dr. Puneet Kumar, consultant physician at Sohana Hospital, Mohali. Today on World Hypertension Day on 17th of May, I would like to talk upon a topic of hypertension. Hypertension means increased blood pressure. The prevalence of hypertension is very high. Prevalence of undiagnosed hypertension and as well as uncontrolled hypertension, both are very high. Hypertension, generally we say whenever blood pressure it increases beyond its limits. Normal blood pressure systolic is 120 and diastolic is 80 mm of mercury. If your upper blood pressure systolic is more than 130 and diastolic is more than 85, we can say it is a beginning of hypertension. Hypertension can be idiopathic, which is called as essential hypertension. Another is the one which run in families, that is hereditary, which run in families. If you are having your parents or siblings having history of hypertension, then you can also become a high risk factor. It becomes a high risk factor for hypertension to develop in you. And how it is diagnosed, sometimes you don't have any symptoms of hypertension. It is only on your OPD routine visits, or you are checking your blood pressure at your home, you come to know that you are having high blood pressure. And suppose if someone is having very high BP, someone may feel headache, giddiness, or feeling of a high pulse rate along with that, then you might check your blood pressure and found it very high. And control of hypertension is very important so as to prevent the end organ damage. High blood pressure can damage your arteries and blood vessels. It can cause myocardial infarction, that is heart attack. It can cause brain stroke. It can cause dementia, that is memory loss in elderly. It can affect the blood vessels in your lower limbs, can cause peripheral artery disease, formation of gangrene in the limbs. It can also affect your vision, can cause retinopathy. So there are so many bad effects of high blood pressure. How to control it? So as to control hypertension, one is dietary restrictions. You should reduce the salt intake in your diet. The salt intake should be around less than 5 grams per day. To do that, you should avoid intake of processed foods from the market. You should try to make the homemade vegetables, homemade freshly cooked food should be consumed with less salt added in it. Secondly, you should reduce the fat content in your diet. Along with that, avoid smoking and avoid alcohol content, because smoking and alcohol both are high risk factors to cause hypertension. At the same time, reducing stress is very important in today's life. Stress has become a part and parcel of our life, and stress is one of the major factors to cause hypertension. To reduce stress, you should do walking daily. 30 to 40 minutes of walking daily is very important. It will reduce hypertension, also will reduce the other bad effects of high weight or obesity. So walking will help to reduce weight also. Maintaining an ideal body weight, ideal body mass index is important to reduce hypertension. Also you can do the meditation techniques, you can do yoga or other relaxation techniques to reduce stress in your life. So these are the important methods which are helpful to reduce hypertension so that we can prevent the hypertension mediated end organ damage in our life. Thank you so much. Stay happy, stay healthy. Thanks.